Welcome to the CRC patient navigation training video on using patient navigation to address colonoscopy barriers. In this video, we will talk about barriers to colonoscopy following an abnormal fit and how patient navigation can help address these barriers. We will discuss the following. What is the problem and why does it matter? What are common barriers to colonoscopy? How can patient navigation help address these barriers? What is the role of the patient navigator? What are the patient navigator competency areas? What is the patient navigation 6-topic protocol? Let's begin by talking about the problem with follow-up colonoscopy. This slide shows that an estimated 10 million individuals complete a fecal test each year. However, not all individuals with an abnormal result get a follow-up colonoscopy. So for these patients, the benefit of completing a fecal test is nullified or essentially canceled out. Why does this matter? This is important because 1 in 20 patients with a positive FIT test will have colorectal cancer. Chances of survival are high in early stages. In stage 1, there's an 80 to 90% survival rate, and in stage 2, there is a 50 to 80% survival rate. Survival rates in stages 3 and 4 drop significantly, so it's important to find colorectal cancer early. People who do not get a colonoscopy after positive FIT have a 7-fold higher risk of colorectal cancer. In safety net practices, only 44 to 53% of individuals who screen positive on FIT obtain a follow-up colonoscopy. Let's talk about what's keeping individuals with an abnormal FIT test from completing the follow-up colonoscopy and what we can do to help address these barriers. In the following section, we will talk about colonoscopy barriers. So let's take a look at patient barriers. Most patients don't realize that if they have an abnormal FIT test, their doctor will recommend a colonoscopy. First, patients may not realize why a colonoscopy is needed. There can be a lack of awareness or language barriers. Second, fear of the procedure and results are frequently reported patient barriers. Many patients have concerns about the colonoscopy preparation process, specifically the bowel prep. Patients often lack an understanding of the bowel prep process, including when to start, what foods to avoid, and the need to consume the entire prep liquid. Patients can also lack a private place to complete the bowel preparation. Third, cost and logistics are another barrier. Transportation challenges. GI offices may have limited transportation resources to share with patients. Patients often misunderstand the need for transportation to and from the procedure, or they may lack the ability to secure transportation. There are also escort challenges. GI offices have strict escort policies and limited escort resources to share with patients. Patients often do not understand that they will need an escort for several hours post-procedure. Otherwise, their colonoscopy could be canceled. Finally, there's also financial challenges, high copays, poor insurance coverage, multiple steps to obtain financial assistance, and the need to take time off work all create cost challenges that can prevent a patient from completing the colonoscopy. Let's take a look at health system barriers. First, high colonoscopy demand can lead to long wait times. Second, there can be provider GI referral communication challenges. Fax referrals from FQHCs can lack proper documentation of the abnormal FIT or incomplete patient medical information, which could delay the process. Third, there are a lack of patient supports. GI offices may have limited transportation, interpreter, or financial resources to share with patients, and patients may lack an understanding of the bowel prep process. So we've discussed that barriers exist, ranging from patient barriers to system barriers. This is where patient navigation can help. The navigator can provide much needed information about the colonoscopy procedure, the prep needed, emotional and logistical support, the encouragement needed to complete the procedure, and available resources to help provide that support, and also coordination. This could include appointment scheduling, pre-procedure visit information, and arrangement of transportation and financial resources. So what is patient navigation? Patient navigation is a process where a trained person works with patients to make sure they get the health care they need. The formal definition is patient navigation for cancer screening is individualized assistance to help patients overcome personal or healthcare system barriers and to facilitate understanding and timely access to quality screening. In order to have a successful patient navigation program at your clinic or health system, it's important to have these core elements from the navigation model in place. First, the patient navigator, someone who understands medical issues, demonstrates respect, empathy, sensitivity to cultural issues, and can juggle patients at different stages of the navigation process. Number two, clinical champions. These are advocates for the program's vision. They provide organizational based support. A champion possesses leadership, passion, expertise, and more to move this program forward. Three, medical oversight. This person provides clinical oversight and guidance. They can provide training, support, and expertise about the colonoscopy, bowel prep, patient eligibility. Four, strong partnerships. Develop strong working partnerships with GI practices, primary care providers, and community-based partners. Demonstrate professionalism, credibility, consistency, and appreciation of these partnerships. Five, the 6-topic protocol. Establish a protocol that includes patient education, barrier assessment and resolution, and patient coaching and support. Six, a successful navigation model includes a data system. This data system collects information about the patient navigation process and outcomes. It assures that the intervention is carried out as planned and is effective. So the patient navigator's role is to help increase rates of follow-up colonoscopy, potentially helping to save lives. The navigator conducts targeted phone conversations to help the patient understand the importance of a colonoscopy, schedule appointments, get connected to resources such as transportation, charity care, interpreters to help facilitate the process, complete bowel prep successfully, and understand the results of the colonoscopy and next steps for screening. Also, the navigator's role is to provide support and understanding to address patient-level barriers, demonstrate respect and empathy, create a meaningful and trusting relationship, and manage patients at different stages of the care coordination process. So there are 4 main content areas that the patient navigator should demonstrate competency in. First, the colon health education. Second, the patient navigation and the navigation protocol. Third, motivational interviewing and messaging. And fourth, data tracking. So let's spend a moment at looking at each of these content areas. For colon health education, the navigator will need to demonstrate an understanding of colorectal cancer and screening options, and the colonoscopy procedure and bowel prep process. For patient navigation and protocol, the navigator will need to understand the barriers to colonoscopy, the role of patient navigation, as well as the role of the navigator, and the phone-based protocol for reaching out and supporting patients throughout this process. Third, under motivational interviewing and messaging, the navigator will be trained in motivational interviewing techniques, effective messaging tips, script review in both English and Spanish, and have the opportunity to practice role playing in both English and Spanish. Finally, the fourth content area, data tracking. The navigator will need to become familiar with REDCap, which is a secure web application for research data, learn how to use the REDCap patient navigation database, and have an opportunity to practice using the database. This video addresses the patient navigation and protocol content area. You've likely already watched the 2 training videos under the colon health education content area. So the navigation protocol you will be using consists of 6 topic areas. Topic 1, this is the first call between the navigator and the patient. It's an opportunity to engage the patient, discuss the importance of screening and bowel prep education, assist with appointment scheduling, and begin a conversation on barriers if appropriate. Topic 2, this is the barrier assessment and resolution topic, which can be addressed at any point prior to the procedure. This topic confirms that the colonoscopy appointment details and addresses any barriers. This may take 1 call or multiple calls or no calls if the patient does not have any barriers to discuss. Third, this is the bowel prep review topic call, which is scheduled for the week before the colonoscopy. This discussion is intended to confirm that the patient has received the bowel prep instructions and understands it. The call can also be used to readdress any barriers. Topic 4. This topic occurs the evening before the colonoscopy to check in with the patient and see how the bowel prep is going. This may be done as a text message if the patient agrees to this communication mode. Topic 5. This topic occurs the day of the colonoscopy to check in with the patient and see if the procedure was completed. If not, discuss plans for rescheduling. Finally, topic 6. The sixth and final topic call is delivered 2 to 4 weeks after the colonoscopy procedure to confirm that the patient has received the results and understands future screening intervals. The first 3 topics are generally the more time-intensive calls that really depend on the patient's needs. The final 3 topics generally take much less time and can be accomplished via voicemails or text messaging if the patient prefers. Finally, this protocol emphasizes the content of the calls rather than the number of the calls. To review, what is the problem and why does it matter? A follow-up colonoscopy is needed after a positive or abnormal FIT result. 1 in 20 patients with a positive FIT will have colon cancer. However, in safety net practices, only half of individuals who screen positive on FIT obtain the follow-up colonoscopy. What are common barriers to colonoscopy? There are patient and system level barriers to a colonoscopy. Patient barriers include lack of awareness, concerns about the colonoscopy procedure, cost and logistics. System barriers include high demand, lack of provider communication, and patient supports. How can patient navigation help address these barriers? Patient navigation is a process where a trained person works with patients to make sure they get the health care they need. Patient navigators can provide much needed information, coordination, and emotional and logistical support to address existing barriers. What is the role of the navigator? The patient navigator's role is to help increase rates of follow-up colonoscopy, potentially helping to save lives. The navigator will conduct targeted phone conversations to help the patient schedule and complete the colonoscopy. The navigator will provide support and understanding to address patient-level barriers. What are the patient navigator competency areas? The patient navigator needs to be trained in the following 4 competency areas: colon health education, the patient navigation and protocol, motivational interviewing and messaging, and data tracking. What is the patient navigation 6-topic protocol? The patient navigation 6-topic protocol is a phone-based program for supporting patients in completing a colonoscopy. It includes patient engagement and education, barrier assessment and resolution, bowel prep review, colonoscopy check-ins, and colonoscopy results review. This concludes the Using Patient Navigation to Address Colonoscopy Barriers video. Thank you for watching. For more training videos, please visit mailedfit.org.